Yes. Yep.
Okay. All right. So, can y'all see the slides and everything? Okay, great. I'm gonna minimize the video of you guys. So if you're waving your hands, I don't see you right now. I just see my slides. So again, my name is Nathan Almond. I am the residency director for the Navy's Aerospace Medicine Residency, located in Pensacola, Florida. And we're kind of, as we were just talking for a second ago, it's under the Naval Aerospace Medicine Institute. So they are the ones that kind of and that's under NMOTC, which is the Navy Medicine Operational Training Center, located all over, but their headquarters is in Pensacola, as is NAMI there. Oh, I'll show you. We've got looks like one of the children is breached. So this is Carter. I'm gonna go ahead and take him back real quick. Hold on a second. Oh.
Tiny humans, huh?
All right. All right. Okay. All right. He's a future aerospace, probably a pilot. I don't know what he's going to do. He's very the force is strong with him, right? So I don't know. He'll do something fun. So that's a little bit about who I am. I think I shared my my bio or my or something with Sean, but kind of a quick story. I was a Navy brat, and so my dad was also an aerospace medicine physician. I spent some of my childhood on the aircraft carriers that he worked on. They call them a Tiger cruise, where you get a little tour, a little cruise of the ship. But I saw kind of what he did, and I thought that was really fun. I ended up doing ROTC at Duke University, at Navy ROTC, and then getting my commission that way. I went to the Uniformed Services University, which is the military medical school, for initial training. I did an internship in family medicine out at Camp Pendleton, California, and then came and did initial flight surgeon training in Pensacola. And my tour as a flight surgeon was actually to stay at NAMI, where my dad was finishing his career as an aerospace psychiatrist, and so I did a lot of flight physicals for about 3 years. Then went from there to a preventive medicine residency located in Chapel Hill, North Carolina, a civilian residency where I learned about preventive medicine. I got my master's of public health from University of North Carolina at Chapel Hill. Did a preventive medicine officer tour in California, and then came back and did aerospace medicine residency. Also, the Army was doing an occupational medicine residency, so I did another year to get board eligible in occupational medicine, and then went from there to being the doctor, the medical department head for aircraft carrier for the USS Dwight D. Eisenhower aircraft carrier. After that, I came back to Pensacola and was the assistant program director for a year. And then after that program director was promoted then I applied for and became the program director. So I've been that program director for, it's my 5th year doing that position. And so it's a little bit of what my career's been like. I was a math major at Duke, and kind of that mathematics bent has always kind of been the way I see things, and preventive medicine, as well as which is kind of the big umbrella, has aerospace medicine, general preventive medicine, and public health, and occupational medicine. So all of them have a statistics, epidemiology kind of component to it, and that all that made sense to me. But anyway, that's just a little bit about me. But glad to talk more about that stuff. But that's kind of where I'm coming from. Most of my career has either been as a resident in graduate medical education or leading a residency in graduate medical education. So it's something that I really like a lot. But there's 16 slides, and I think this is number 1. So I will not spend a lot of time on the slides, but really want to get to your questions and see what things that you're interested in and how I can talk about that. Okay, so let's see, the next slide is what is aerospace medicine? And so some of you may recognize the Blue Angels here flying over an aircraft carrier. Aerospace medicine is looking at health and safety in aviation and space travel. So they're kind of the two components, right? You have the aviation medicine side, and then you also have the space medicine side. So that you may have different fascinations with either or both of those. Specifically with aviation medicine, we're looking at the effects of that environment, right? Which has a lot of physiology involved. There's different atmospheres, different temperatures, different forces. It's a different. It's just a different environment, and so as you might guess, one of the most challenging environments is the flight deck on aircraft carrier, right? So that's a great example of where you have changing temperatures and you have lots of noise and probably some air pollution there too, with jets coming and taking off and landing. So it brings me to the point that aerospace medicine really, you could say, is kind of the ultimate occupational medicine job, because you're working with folks that are in a very challenging occupational environment. So a lot of folks that train in my program will end up taking the specialty exam in occupational medicine as well as aviation medicine. Which answers the question a lot of people have, like, what do I do when I get out of the military? There's not a lot of aircraft carriers in the military, but occupational medicine is in high demand on the civilian side, and a lot of folks will do that to transition. So we have just we got another picture of an aircraft carrier there for you, and then some folks are really fascinated by the space medicine side of aerospace. Where you're looking at how does space travel affect the different systems, and as you can probably guess, there's a lot of different considerations for being in that space environment. My world, last 5 years or so, has been to run the Navy's Aerospace Medicine Residency, which is a program. It's a residency program, just like family medicine or pediatrics or orthopedics or something like that. It's specifically aerospace medicine, and so you can we can talk more about those different those different possibilities. But there are basically 3 military aerospace medicine residency programs, Army, Navy, Air Force, and then UTMB, University of Texas Medical Branch, has a civilian residency, and then Mayo Clinic, I believe, has a fellowship in aerospace medicine. So those folks, pretty small number of residencies that are out there. So these are the objectives. What our program wants to do. Basically getting people smart, not only for aerospace, but also in the general preventive medicine arena. When I was talking with your board earlier today, talking about, we really are all preventive medicine experts. So if you become familiar, if you engage in the aerospace community, there is a high likelihood that you also have expertise in general preventive medicine things such as COVID, for example, different outbreaks. So we also want to get the residents aware of policy and research and how to not only learn the policy, but then also to lead policy changes and those type of things. And what we do, our mission is to provide support to the line, to the operational forces, and not tell them what to do, but to make recommendations to the line about how to operate. And so that's that bullet there. So our current program, it's a 2-year program. All the aerospace residencies are typically 2 years. The first year, well, before you can apply, typically there's an accrediting body. No matter what, if you end up going pre-med and going into a medical residency, you have to do something called an internship, which is your first year as a physician. And just about any first year internship satisfies the requirements to apply for an aerospace residency, whether you do it in the Army or the Air Force and Navy. But we have a 2-year program that has clinical rotations throughout. And while they're doing that, there's a concurrent enrollment in the Master of Public Health program here in Pensacola at the University of West Florida. After the residents have completed those 2 years of aerospace medicine residency, then they can apply for taking the board exam, the specialty board exam in aerospace medicine, and then after they've done some of their follow-on tour, they're also very successful at being able to take the occupational medicine board, so they can get dual board certification. This is an example of our kind of what our curriculum mainly looks like. You can kind of see that there are clinical rotations throughout, but then we also have a lot of courses that we send folks to, and things like ionizing radiation, the MIR course, medical effects of ionizing radiation. The FAA, they spend time there. We send them to NASA for a week to spend time with NASA. So you can kind of see a lot of that first year is kind of is some more general clinical experiences, pulmonary, orthopedics, cardiology, psychiatry, urology, women's health, things like that. And then in that second year, they do a little more aerospace flair. So that, and remember, they've all kind of already done a year of clinical medicine and internships. This isn't the first time that they've had those exposures to the different topics, but they might, in an aerospace psychiatry month, spend a lot more time and more detail interviewing folks that are wanting to continue their aviation career, for example. So that is our curriculum. And then I have just a couple of examples, if you're interested. It's just some things that other residents have done for their research. It's just kind of a sampling more than anything, but just an example, a couple examples of what they've done. And a lot of folks will ask, what do we do after the residency? What kind of positions or billets, to use a military word? A lot of the senior officers end up going into senior medical officer type positions. So they're the head of the medical department on an aircraft carrier. We also have a majority of the kind of mid-grade officers end up going out with the Marines to be with the Marine Air Group and being in charge of that. There are opportunities. We do have occasional folks that will go to NASA and be flight surgeons. I don't think we have one person there right now, but there's been a history of Navy aerospace trained folks going to NASA, and then other assignments and research, and then also in the occupational medicine setting. After the military, what do aerospace physicians do specifically that come from that leave our program as graduates? A lot of them will turn to FAA or the airlines. They can work at SpaceX or NASA. As I mentioned before, some of them will go into occupational medicine type positions, public health, executive medicine. They could go and run a hospital or something like that, as well as different university academic type positions. And this is our residency class. Actually, one of the one that's kind of in the middle here. He's our residency manager, who had he worked as a rescue swimmer, and his prior career as retired Navy chief. But he had an old flight suit, so he put it on for the picture, which is pretty great. So this is our group outside of our building, our NAMI building. So that is, let's see, I'll stop sharing, come back. That's sort of the information I wanted to share with you guys, but I wanted to, like I say, kind of leave lots of time for questions that you might have, or you know, about presentation, but it doesn't have to be about that. We can kind of talk about whatever might be interesting to you. I understand that there are a lot of different avenues that people are interested in, not necessarily even the pre-med route. But yeah, glad to take questions or whatever you all want to talk about.
Okay, there we go. Yeah, for sure, absolutely. So we had a few pre-sent questions, so we could kind of go through those and see what your thoughts are there.
Sure.
So the first ones, as you mentioned, there are a few residency programs in the country or around the world, very, very few in comparison to the rest. But of those limited number, what would you say sets your residency curriculum, the curriculum, apart from other residency program curriculums?
Yeah. Well, I think one of them is that just flight surgeon training is very different in the Navy versus, say, the Air Force or the Army. You might get I think it's like 6 weeks long versus 6 months. You get in the Navy, you actually get to go through all of the kind of that primary flight training. So you go through survival training with the pilots, the guys that are student naval aviators. You're sitting right next to them when they're doing their ground school. You really kind of learn some of those unique stresses of the all the different topics that they're learning about. You're learning about taking the same tests and everything like that. So I think that relationship is maybe a little stronger. That would be my, based on kind of, I mean, just knowing what someone else is going through because you've gone through it too, I think helps. So having that specific experience of either being a flight surgeon because you've gone through that training, or flying with the line guys. I think that's a big thing. I mean, everybody's going to get a master's in public health, right? I mean, that's the the ACGME is the accrediting organization that accredits all the United States residencies, and they have a specific, you'll get, these topics, and so everybody's going to get a lot of that same background, fundamental background. There's something called the core, which is kind of your biostats, epidemiology, environmental health, health services, those kind of things that everybody learns, whether you're aerospace or general preventive medicine or occupational medicine. Everybody has to, in fact, when they sit for the board exam, everybody takes that initial 3-hour exam on the general core. And then when you take the second half, like the afternoon test then you break up and you either do occupational medicine or aerospace medicine or general preventive medicine. So after you've done that successfully and taken the morning and afternoon, then if you want to get certified in one of the other programs, you just have to take the afternoon. So it's good. You don't have to retake the morning, which is a kind of a bear, because it covers so much material. But if you've done one of those 3 residencies, and then you've been practicing in another for a couple of years, then you can go to the board and say, hey, I'd really like to take OcMed now because I've been doing occupational medicine. And then they just, so everybody's going to have that general information, I guess is what I'm saying. But I think specifically the flight training is very different in the Navy, and the flight surgeon training that you get is a different flavor, more flying. You're in you're in a 2-seater. Right when I went through, it was the T-34. It was a turboprop. Now it's the Texan, which is got an ejection seat. So it's a fun little jet that you get to fly. So I think that's from the residency perspective. I mean, the services are all different, as you all probably know. Anyway, Air Force versus Navy versus Army. So I won't belabor on that. But I think that should be, if somebody's thinking about the military, that should be a big part of it, because you're part of that bigger organization. So that's how I would answer that.
Absolutely, that's very exciting. Yeah, I don't think you get to fly like a 2-seater with an ejector seat. I can't speak today. In other residency programs, so that's definitely a plus.
Yeah. Plus, you get the helo dunker, but I don't think that's a plus. But
I looked that up. That looks insane.
It's crazy. It's crazy, and you have to do it every, I think, 5 years or something like that. But yeah,
oh my God.
They do it in incremental steps, right? So that you practice, like they have something called a sweat chair, where you sit in a chair and they turn a handle, and then it flips you upside down in the pool, and so you're upside down, and you've got to untangle your seat belt and or your restraint and get out. But they kind of, it's incremental steps. They don't just throw you in the dunker and say, all right, good luck.
Right.
But it is stressful to be in the seat and have the thing hit the water, and then the water's rising and you flip and
deal with it. Here, I can share my screen, because if people haven't looked up the helo dunker, maybe you can kind of talk us through it. So here it is.
Yeah, that's what it
incredible.
is. Yeah,
so you just get put in this and they just drop you down then?
Yeah, well, they don't just, I mean, they train you about how to successfully get out.
Okay.
For example, you have to find something called a reference point, right? Because if you don't have a reference point, when that thing flips upside down, you're not going to know where you are. And after a couple of rides, they give you blackout goggles, so you can't see. I mean, you wouldn't. So you have to find that reference point, and you have to wait after the things flipped, and kind of wait for the blades to stop turning, right? You don't want to try to get out too early, and then and you don't want to unbuckle too quick, because then you can fly all over the place. And yeah, so they give you incremental steps to train, and they don't and as you to find your reference point and wait and unbuckle and pull hand over hand. And there's a lot of kind of set steps that they kind of, it all kind of comes together when you get to the dunker, So
Wow, that's amazing.
you're practicing with pulling yourself hand over hand, and like it's almost like they have these different stations that give you the skills and the confidence, so that when the water starts rising, you don't panic. But it gives people confidence too when they get in a helo that's going out at night over the water, that you've had the training, so you can successfully get out if need be. So, but yeah, I think that's a different part of the Navy's flight surgeon training compared to others, and not everybody does the whole residency in aerospace medicine. There's a good number of folks that they say they want to be a radiologist or something like that. They can do flight surgery in between that first year of training and when they actually get accepted to the radiology program. So it's kind of it's a fun adventure for folks. Maybe if they want to do something fun before they go, spend the rest of their career in a hospital, something like that. But
awesome.
what other questions do you guys have?
So I can continue on at least with the pre-submitted questions we have.
Oh, sure.
The first of which being, you kind of talked about the distinguishing factors between the two, but what if you could put it in a pros and cons type of list? What's the pros and cons between entering aerospace medicine via the civilian route versus the military route as you presented it?
Yeah, so one of the pros of the civilians, I mean, I've kind of, I don't want to paint a broad brush of saying, well, the military is the only way to go, because that's my career is, I mean, as you kind of heard, I really like civilian training too. I mean, going back, doing ROTC instead of an academy, or doing my initial residency and my master's in public health out at Chapel Hill versus the Navy's Aerospace Medicine program. And I think that one of the, let's see, pros and cons are tough, but I would say like there's a pretty good track record for UTMB as far as becoming an astronaut. I know the Navy's also produced astronauts too, but I think there are a lot of connections that UTMB has that the Navy, if you want to be there in Houston and do it, I mean, that's a great program, and so on the military side, you're going to be traveling a lot. You're going to be stationed in a bunch of different places, and that might not suit your desires or your family's desires, those kind of things. I mean, being in the military is it's definitely not for everybody. The civilian side, like I say, has plenty of connections. I think one thing that's different is that the civilian side requires you to be board certified or trained in a different residency before you go to aerospace, while the Navy allows you to be your sole residency to be aerospace. So if you want to get right into aerospace, I think the military is specifically the Navy or the Army, both of those services. You can go right into primary training as an aerospace resident versus needing to do some other stuff, having maybe a different primary care residency before you go in. So depending on what your aspirations are, I think that's probably going to drive a lot of your decision making. Number one, do you want to be in the military or not? And number two, like what specialty are you interested? Because that could have a lot to do with it. Some folks are not real excited about being a primary care doctor first, or being an internist or family medicine or peds or something like that. So I would look, if it was me, I'd just look at what the requirements are to be in that type of residency. If you're looking at like a UTMB, but both that and Mayo are both, requiring another specialty first. So I think that's a pretty fundamental, not really a pro or con, but just you have to look at the system and how it's set up and what those requirements are.
Okay.
So I
Oh, yeah, go ahead.
believe I have been designated the next pre-submitted question. I'm Kate, by the way. I showed up
hi,
a little
Kate.
bit later. I'm the vice president of Spartan Aeromed. So it's nice to meet you.
Oh, nice to meet you.
And we've all been very pumped and excited and hyping up this meeting. So it's really appreciated.
Oh, it's just a thrill to be able to participate. I appreciate Sean asking me.
Yeah, we're all very thankful for Sean reaching out to you for sure. The pre-submitted question that I have is, what are the benefits of being a doctor in the armed forces compared to being a doctor in the civilian world?
Oh, wow. That's a great question.
It
Who
is a
asked
good
that question? Whose question was that? Did anybody want to own up to
Hopefully
it?
they're here. They should own up to it because it's a very good one.
That's a
I was
great
reading
question.
it and I'm like,
Oh, I mean, the first thing is that medicine even, I don't know, how many folks are pre-med right now? There's some online that are pre-med. I will tell you that when I was at Duke, most of my ROTC class was pre-med, not a lot, not the whole class, but a lot. And there were only two of us that ended up graduating and going on to medical school. And what I would say about that, even that, because whether or not even to go down the doctor route, don't, if you're thinking about that, don't let your organic chemistry grade determine whether you think you're going to be a great doctor or not. I'll just say that. Happiest C- of my life, right? Very glad I didn't have to take that one over. But those courses are meant to weed out, so medicine or pursuing being a doctor, for example, it's probably like that with just about any career. You just have to keep going, even if it's not going as well as you would hope. I mean, if that's what you want to do, you just kind of keep at it, and it's what they say, like, it's not how many times you fall down, it's how many times you get up. I mean, you just got to keep getting up and going for it. But the question about being in the military as a doctor or being a civilian, I'm biased, obviously, because I'm in the military. I've been in the military. Graduated from medical school in 2000, so that's not higher math. Thankfully, it was helpful to graduate in 2000, so I can quickly figure out how long I've been a doctor. But being in the military as a physician, I would say, has some advantages I can talk to. One is that you're not paid based on how many patients that you see. There's not a treadmill that if you run faster on the treadmill, you get paid more. And that's one thing that I decided a long time ago was not to do what they call moonlighting, where you go on the weekends or something and see more patients and that, to supplement your income. I think that the ability to I'm in the dark, so I'm going to turn my light on here. The ability to be kind of satisfied with whatever your income is. I think that's almost like a superpower or something. Like, you don't have to because otherwise it's just everything is like, well, if I work one more shift, then I can afford this, or I can pay for that, or I think that being in the military, you don't have some of those same pressures too, right? As a military physician, nobody is judging me on the car that I drive and park in the lot, or the clothes that I wear, or that, if that makes sense. You are part of also a larger mission than specifically medicine, right? It's not all about the bottom line and about the dollars and those things. You can the whole making a difference thing, I think, is really real when you're supporting a cause that's bigger than medicine. It's with the military, you're protecting and defending the Constitution of the United States. I mean, it's awesome. Um, but so the downside would be that they don't call them ASCIIs. They're actually called orders. Like when they give you that your next duty station that you're going to go to, or whatever it is, uh, you know, that's a lack of some choices maybe. So it's almost like you have to be willing to go wherever the military wants you to go. But then you get to go to a bunch of cool places. So it's kind of that both sides of the coin, I think. So maybe a little more autonomy if you're a civilian medical provider, as far as you can decide, I'm going to go here, I'm going to go there. But I would say that too, on the military side, there are opportunities there, not just geographic, or but also even just like looking at my career, I was able to go and do 3 residencies, and uh, you're paid in the military based on how long you've been in and your rank, not are you a current resident or not. So if you were a civilian and you did a residency and then you wanted to go back and do a different residency, it would be really, really challenging to do that, just because of the incredible pay cut that you would take. So I think that there are, I mean, if you want to do this, kind of the same thing, you can do the same thing in either the military or the civilian side. But if you like a little more variety and maybe a little more options, knowing that there's some obligation that comes with that, I think the military has got a lot going on. I don't know if that's helpful, Kate. It's a little bit of rambling, but if you've been a Navy brat, then it's kind of a little bit of what you're used to too. If every 3 years you're kind of ready to move again, um, versus growing up in the same place and change and those type of things. But yeah, it's challenging, and I think that if somebody's considering the military, and specifically being even a doctor in the military, you don't have to decide like I'm going to do 20 years in the military. Like I'm going to go and do a full career. There are plenty of folks that do a little and they enjoy it, and then they're like, you know what, it's been great, and now I'm going to go to North Carolina and be out of the military and raise my family, or do whatever I'm going to do. So it doesn't have to be an all or none. I think I think it's easy to kind of approach things saying, well, it's I've got to decide it all right now. And I tell one of the things I love about my job is that every applicant is kind of wondering the same things you guys are. Like, what do I do with my life? And is it military? Is it civilian? Is it aerospace? Is it pre-med? I don't know. And I tell them a lot of times, like, we kind of have this, we put a lot of pressure on ourselves to figure it all out and get it exactly right. But a lot of times these opportunities that we choose between end up swinging back around and giving, like when I went through training, you couldn't be a primary aerospace resident. You had to have another residency. I went and did preventive medicine, which is not really a clinical residency either. But then they kind of changed the rules a couple of years later and said, well, actually, now you can if you're not a primary care provider kind of type thing. So it's just one example from my life, but you know, the aviation world has kind of there's an aviation term called the scan. So you're kind of, like you could, even if you're not familiar with it, when you're driving your car, let's say, and you're looking in your mirror and you're checking the rear view and you're looking at your speedometer and you're kind of, you don't get fixated on one part of, you're not looking just in one spot. You're kind of just scanning around. And I tell folks all the time, keep your scan open to see those opportunities, because whether it's civilian or military, they're those folks, and the kind of what you're doing now, or you come to a meeting where there's a lot of people with that shared interest and passion, but getting involved in those type of things where you're able to be exposed to so many different uh, uh, careers, or just maybe you have absolutely no interest in the military at all, but maybe there's something in the military that you could do in the civilian side, that, with research or whatever. But anyway, it's a tough question. I think you probably could make more money maybe on the civilian side a little bit, but you're also going to maybe work a lot harder, if that makes sense. Potentially, I mean, you can work hard in the military too, but the beauty of it is that there's no incentive to work more to make more money, which I think disengaging that really takes a little bit of the pressure off. You can really practice medicine, and you're not worried about trying to bill or the insurance, and I can only spend 10 minutes with this patient because I got to get to the next patient. And it's aerospace medicine is really kind of a concierge medicine kind of type thing. Concierge, I don't know if I said that right. You're taking a population that's pretty healthy, and putting them in an environment that's a different stressful environment. So it's more than, like I kind of mentioned, in psychiatry you have a whole realm, but then aerospace psychiatry, you get to really dive deep and spend a lot more time kind of getting to know and understand all the factors that are kind of coming in. So I think that field in particular, maybe you're spending it's a different question. You're not trying to just diagnose that cold and get them out the door. You're trying to make sure they're safe to fly. So those are some ramblings I have about the military and the civilian side. It's definitely a tough choice to make, but you don't have to get it right and say, I mean, there are people that are civilians that will come into the military after they practiced for 10 years, and there are folks that do 10 years in the military and they're like, okay, I want to go do civilian side now. So it's not an all or none phenomenon. I think you keep your eyes open for opportunities, and the military is very glad to have folks that have significant clinical civilian experience. They have big signing bonuses and stuff like that. So but yeah, is that helpful?
I think
Okay.
it's like perfectly helpful. Yes, that was great. Thank you.
Oh, awesome.
I think I have the next pre-asked question. It's, how can individuals get involved with the armed forces after graduating from a civilian medical school?
Oh, sure. Oh, that's great. So I think there's a military recruiter that you probably talk to, and they have so if you and you kind of have all the cards, right? If you are already a doctor, and you can check out the different services, and they have these they're called like signing, but they're basically bonuses based on what you've done. If you're looking to get an internship or a residency, that may be, you definitely would have a lot of what the military is asking for are folks that are already trained in something, you know. So you might do a residency, like say that you were, say you did a residency like at UTMB or something, and you did aerospace, and then you're like, oh wow, I'd really love to join the military. You know, now they really want people that are already trained in aerospace medicine. So like, oh, here's my residency graduation. I got my board certification, and so there would be opportunities to do that. I don't know about right out of medical school though. I'm not sure. You'd have to look at. So there's something called the GME selection board that the military does. It's different from the match, right? That what you do. So the Army, Air Force, Navy, they have a selection board that meets kind of right around the like late November, early December timeframe. And they put out a note, like an instruction about how it works. And there are opportunities for civilians or for reservists to apply, but they're not prioritized compared to the people that are active duty. Because if you go to the military med school, USIS, in Bethesda, Maryland, like you're guaranteed to get a residency in the military, right? Like it might not be the one you want, but you're going to get one. And most of the time you get what you want. But as far as the internship, so they're guaranteed. So they have priority over say a civilian getting already being done with medical school. But I would talk to a recruiter about that if you were interested in joining the military after medical school. The fact is that you won't have obligated service means that you can take a nice sign-up bonus but it would typically be, I think, probably after you've done a residency. It's my best way to put that. Is that helpful?
Yes, it is. Thank you.
Okay.
And I think
Yeah, I
that's,
think
sorry.
cool.
I was going to say, I think that's all we have for the pre-submitted questions. And
Okay.
I think Miles had his hand, had a question possibly.
Yeah, thank you. Dr. Almond, thank you for being here. And thank you for what you do. Really appreciate all that you guys do for us.
Thanks, Miles.
One of the things you mentioned was, sitting in the back of a two-seater and whatnot. With the, I guess, change to having a lot more single-seater planes in the military now, do you have, I guess, separate question at that. Do you have much information on pilot physicians at all? Or I guess aviator physicians, if you're in the Navy?
Yeah, sure. So you're about the dual designator program is probably what you're asking about.
Yes.
Yeah, and so a good number of folks that apply to my program were former pilots, former helo pilots, former fighter pilots, that type of thing. And we've been able to work with their curriculum so that some of them, a couple of the fighter pilots I'm thinking about, are able to do their residency, but also do instructing for the students that are down here in Pensacola. So I think that's the coolest, right? Like you're a resident, but you're still instructing other students based on your background. So there is a dual designator program in the Navy that allows folks to do both, be a physician and also to be a pilot. And what specifically, what kind of questions did you have about dual designator? I mean, usually the ones that do that were pilots before they went to medical school. A lot of times, so when I was in Pensacola doing my first flight surgery tour, I lived on a block just those starter houses or whatever, and it seemed like most of my block were line officers that were going to go to the Uniformed Services University, kind of around that 10 or 11 year mark, when they finished their obligated service for being a pilot, and they're wondering, what do I want to do? A good number of them end up going to medical school. But yes, there is a dual designator program, and pretty straightforward, I think, if you've been a pilot and now you're a doctor. But I think it might be a little more challenging to do. Like if you want to do that, I would go to pilot school first. I think it's harder if you're a doctor and the military's trained you to go, to be a physician, to say, well, now please send me through. There's age requirements, right? I don't remember exactly if it's 33 or 34 or something, but if you at a certain age, the military's like, no, we're not taking people for flight training. You're a doctor and you're too old to go through the aviation pipeline. So you have to be, a lot of that is really looking at the requirements, like I said before.
Yeah, you basically asked all the questions that I was going to ask. So I guess the only other one I have is, do you foresee that field becoming bigger? Because right now, from some small sources I can see on Google, it talks about, how that's one of the rarest billets in the military, just because of the amount of training that you need for just one of the designations, but let alone to have two of them is years and years of schooling.
Yeah.
Do you see that becoming bigger?
I don't know. I think that there's always going to be a place for that, and if you have the background, I mean, to do both of those things, there's going to be a desire for it, to be. I remember, if you because like, especially like the training environment, right? Like the training environment is really going to want, like, it's great to have a doctor, but if you have a doctor who's also a pilot, it's like, oh, this guy knows us, right? It's like even more amplified from what I was talking about before, where you go through 6 months of flight surgery training, but so you get to you understand the mission, I think, a little better, and you've walked in their shoes for a little bit. But if you've really walked in their shoes, like you've been a pilot, I mean, I think there's a high desirability from the line operators for someone who, it's like, oh yeah, he gets us. He knows exactly what it what it was like, because they were at that squadron, not as a doctor but as a pilot. So yeah, I don't see it going away, but it's definitely a challenge. I mean, it is tough to get through medical school, and it's tough to get through aviation training. So to do both. I told you my dad was aerospace physician. He was a line guy before that. He was a submariner, and he talked about how his training as a submariner in many ways eclipsed medical school. I mean, some of the nuke training that you go through, it's pretty rigorous. So I mean, I've kind of come to that conclusion just in observing, is that everybody works hard. I don't care if you're a doctor or a submariner or people are working hard. So yes, physicians have a burnout too, but we don't have the market on it. But yeah, great. Thanks for your question, Miles.
No, thank you. It definitely shows when like someone knows about the topic that like they're trying to help you with. Like growing up, I going to a doctor. If they played hockey, it's a lot easier to tell them like what I got hurt somewhere in the body. Like,
oh yeah,
if they never played hockey, they can't understand like, oh yeah, I've had that exact injury before.
Right.
But like what you're saying with pilots, it's if you are a pilot, you've walked in their shoes, their struggle. In that sense, not that strong, I guess, of the struggle.
Yeah. There's a requirement for Navy flight surgeons to fly 4 hours a month, because, I mean, how can you sit across from somebody and say, yeah, it must be really tough? I mean, if you're not in the plane with them, then that. So anyway, no, it's a great point.
Awesome, thank you.
Fantastic. Well, does anybody else have a question they'd like to ask? If so, ask away. If not, I have a question, but I just want to see if anyone else wants to go. So the question that I was going to ask, you definitely touched on this a bit earlier, but
Yeah.
under NMOTC, there are like 8 subdivisions. So there's NAMI,
Yep.
there's NSAMI, there's like NUMI and NMT and all these things. So could you kind of touch on what the differentiation is? You kind of said earlier, like for some of them, it's aircraft carriers, and for some of them it's pilots, and for some of them it's like special operations. And how do you kind of feed into those different aspects? So if I wanted to do, I'm going to pick one like NSAMI or something, what would I?
Oh, with special forces.
How would I do that?
Yeah. So that is a great question. If you want to be a doctor for the special forces, and I think you could get there from aviation medicine. Just look to get stationed at one of those bases where they do special forces training and those kind of things. As far as, and there's overlap too, right? Like the SWMI, the Surface Warfare Medical Institute, it talks a lot about about ships. And so even as an aviation medicine specialist, you still go to the training that they have about ships, because an aircraft carrier has some special things about it, but it's still a ship, so that you still have a lot of that common denominator. And these organizations, they're not just treating. I mean, yes, they train physicians, but they train the whole Navy, right? Like it's not just. I mean, you might have something called an independent duty corpsman, or corpsman training. It's not specifically, okay, this organization just. I mean, like NIST, the Survival Training Institute, they train everybody who's going through that could be flying on a plane or on a helo, and they're the ones who sign off your qualification to be able to be in that aerospace environment. So it's everybody that's in the environment. It's not just the pilots. It's that whole the whole group of folks that are involved with that environment. So they have all these places have different courses, and there are points of contact and things like that as far as doing those different courses. But if like your goal is to be so the different specialists, like say like a lot of the physiologists, they end up at the Survival Institute and the NIST. There are different positions at each of those detachments for those different specialists. Like a lot of the aeromedical specialists end up at NAMI, or if you have a lot of experience with special forces, you might end up at NSOMI doing and that might be someone who maybe was in special forces and then became a doctor, kind of like what we were talking about with Miles a little bit. A lot of it is not necessarily, okay, I'm going to be a special forces doctor. It might be, okay, I was in the special forces and now I'm a doctor, and I think these are my people. This is what I want to do. And so there might be courses, but you may be going to teach the courses that NSOMI offers. Does that make sense? It's not necessarily I want to go to NSOMI. It's more like NSOMI is teaching that subject, but won't necessarily make you an expert that now you can. You can sometimes it might be even exposed, just kind of familiarization, like for example, with NIST, going through and getting survival training, that type of thing. So I don't know if that helped or not.
Definitely, yeah. I think it kind of clarified how kind of medical training in the Navy would work, at least for physicians and these kinds of things. You can't just like go into whatever direction you want. You got to have a firm background and then get in there.
Right. You wouldn't just.
Yeah.
Right. That's exactly right.
Yeah, you just don't like fill out an application, say, put me in the special forces. I want to go coach.
Yeah, no, it doesn't work like that. I mean, you could, but they might laugh at you. So.
Yeah, I wouldn't want to be laughed at by a bunch of SEALs.
Right.
That'd be terrifying.
Yeah.
Yeah. Last question that I had. So what is your kind of ambition for the future? So now you are, heading this residency program for the Navy.
Yeah.
But, so what next, if anything? Where do you want to go? What do you want to do with the program? Do you want to are you wanting to go to a different direction? What's that like for you?
Oh, that's a great question. I'm actually turning over the program in the summer to the next guy, right? So you do 20 years in the military, and then you can retire. But you have to be in the military. Like if you take the next rank, if you take a promotion, you have to stay at that rank for 3 years. You can't just take it and then say, "Hey, thanks." I mean, they give it to you so that maybe you do something with it for a couple of years. I kind of mentioned it before, and you saw. I don't know if you could see it or not, but you saw my 18-month-old. Up to we have. I have a daughter that's almost 18, and then three in the middle of that. So with us doing homeschooling, and my mother-in-law lives with us, those kind of things. I don't know that I think it's a good question to answer for everybody. Is like how much is enough, right? Not just money, but like title and rank and job, and like the next step for me, if I wanted to pursue it, because I'm at 20 years, but you can stay till 30 in the military, right? So you can keep going, and they'll keep giving you lots of opportunities to be in charge of stuff. And the next thing for me would be like to be in charge of NAMI or something like that, or to be an XO or CO of a hospital, or of an operational force, to be the medical officer advising the operational commander, the admiral, or something like that. And I those things would be really interesting and fun. But my wife and I've dreamed of retiring. I mean, I'm 46, but I think kind of how I mentioned before, like different phases of life, and it's but we're excited to stay in Pensacola. My mom and dad retired. My dad retired here in Pensacola, so I'm gonna. So they just live about a mile down the road. The grandparents are right there, and mother-in-law lives with us. Like I may have said that already, but so I don't have a lot of career aspirations at this point, to be quite frank. It's probably to be the best husband and dad that I can be, and I think I might, if there's, you never say never. I think, I'm keeping my scan wide open, but I don't. I've really tried to make the effort, at least, to not let what I do define me. And I think that's hard. That's a really hard thing to do, right? Because you do your job for a long time, and especially in the military, when you get rank, people defer to you. I mean, when they see the little, whatever it is, the little eagle, people, they laugh at your jokes and stuff, and even if you're not very funny, it's just how it is. So I think it's tough to leave, not just the military, but I think any organization you spent a lot of time committed to, and so I think it's a struggle, not to let your position, your vocation, kind of define who you are, and it's just, so I don't know how successful I've been at that, but my plans to probably get to retire in a year or two. Actually, not a year, to probably, like, I would say February of 23. That's my goal. To put a pin on it. So, but there are lots of opportunities. A lot of folks in aerospace medicine end up running stuff. There is a nice correlation between preventive medicine, population health, where you're looking at groups of people, like patients. You're looking at populations, right? It's a really nice transition to go from that to looking at like a group of providers, for example. So to be able to so the executive medicine kind of in charge of large organizations or that type of thing. It's a pretty easy transition to go from the preventive medicine population perspective to being an executive medicine kind of type thing. And a lot of the executive medicine stuff, they really like the whole masters in public health kind of deal because again, you're looking at things from the forest perspective instead of the trees. So if you have aspirations to do executive medicine, preventive medicine, aerospace, OCMed, PrepMed are all great at fundamental like systems-based approaches that I think make a it makes a nice trajectory if that's something you aspire to. That was a long question to what do you want to do next, but yeah, I don't really, there's a lot that I think would be fun, but I mean, being able to do mentorship and I kind of tell the residents that I'm like half guidance counselor, half tour guide, and it's such a treat, to even just to talk to you guys today. Really, it's really professionally fulfilling to be able to, like I say, not like, oh, you got to go in the military and you got to do this, but like say, hey, there's a lot of stuff out there, and some of it could be maybe a good fit, whether that's UTMB on the civilian side or aerospace or the aerospace, OCMed, PrevMed residencies are like these great secrets that people really don't know about. You have to like run into somebody. Everybody knows about family medicine and pediatrics, and because the world is full of all these primary care specialties. But this is like a tiny little group that once you hear about it, you're like, wow, that's cool. I thought I had to be in the hospital all the time if I was a doctor. So no, you could be flying a plane. It'd be awesome. So anyway.
Fantastic. Thank you so much. Yeah, it's been an absolute, honor to kind of understand how you got to where you are and what your aspirations are and what you're doing, and just to learn basically from you has been great. It's been a wonderful opportunity. And if nobody else has any questions, I think we'll go ahead and call it a wrap. It's been just a little over an hour. But thank you again. Thank you for everybody that showed up. We hope that you enjoyed the meeting and being able to meet Dr. Almond. And we'll be posting this on our YouTube channel. So if you want to come back and in the future and you want to figure out what you want to do, now you're in the Navy and you want to get some guidance, you can revisit the video maybe. But again, thank you very much. I hope you guys have a great night. Take care.
Awesome. Thanks for having me. And I think my email and cell are on my information. If it's not, if you have questions after the fact, feel free to engage. I'm glad to help any way I can. Thanks.
Mm-hmm. And
Absolutely.
I'll help share those
we'll be
as well.
sure to distribute that.
Mm-hmm.
Mm-hmm.
Okay.
Exactly.
Awesome. All right. Good night.
Thank you so much.
Thank you
It
so
was
much,
an
Dr.
honor
Almond.
and a
Hi, thank you so
pleasure.
much.
Okay. Bye.
Hi. You have a very cute kid.
Yeah,
Oh.
he's so cute.
That was definitely the highlight for me. It was like, oh, you don't belong here. So it's good.
Oh, the world
Very
of
cute.
Zoom.
That's right. That's right.
Yeah.
All right. Good night.
Thank you.
Hi, thank
Good night.
you.
Take care.
Okay.
Bye.
Bye-bye.
Bye-bye.
Oh.
Oh, my
Pretty good.
heart.
My face
Wow.
hurts.
So nice.
That kid's cute. Watch him be like a pilot one day. That'd be amazing.
Also,